Welcome to the Perfect Dose podcast. We dive into everything you need to know about skincare treatments, wellness tips, and skincare routines so you can look and feel your best. If this sounds like you, make sure you hit subscribe so you can stay up to date on the latest episodes. I'm your host, Dr. Kristen Herzog, board-certified nurse practitioner and injection specialist. My med spa, The Perfect Dose, is located in Scottsdale, Arizona. If you are interested in becoming a patient and seeing me in practice, make sure you head straight to my website. If you're a medical provider and you want to stay up to date on the latest trends, techniques, have access to my protocols, articles, and business tips, make sure you follow me on Patreon at The Perfect Dose. For everyone else, follow me on Instagram and TikTok at The Perfect Dose. Hi everyone, welcome back to this week's episode. If you've been noticing smile lines, those lines beside your mouth are getting deeper or they're just starting to creep in, this episode is for you. On today's episode, we are going to break down smile lines, what they are, what causes them, and then we are going to talk about how to treat smile lines with treatments ranging from in-office treatments to things you can do at home. So what are smile lines? Smile lines are the lines that start at the crease of your nose and go all the way down to the corner of your mouth. Now, we notice these lines are some of the first signs of aging, and I get patients in my practice coming in all the time. It's brought up in every single one of my aesthetic consults. How do I treat these lines? How do I make these lines go away? So I am so excited to talk about this to you guys so you can understand exactly what's happening, what's causing it, and then what we can do about it. So smile lines are often referred to as smile lines or nasolabial fold lines. Now, nasolabial folds are the medical term. So if you go to an aesthetic practice, they are going to consult you on treating your nasolabial folds. However, they are often referred to as smile lines because when we smile, that's when they become more apparent. And over time, with continued smiling, which is unavoidable, I hope you guys are smiling. Smiling is natural, it's fun. But over time, these smile lines will become etched in your skin with repeated smiling and a few other causes. So what causes these lines? Number one, like we said, is the repeated act of smiling. And again, we're not going to smile less often. So this is just something that is not going to change. It's unavoidable. And over time, this muscle action of smiling will let those lines etch into your skin. The next cause of smile lines is going to be because we have skin laxity as we age. So what happens is when we're young, we have this firm, bouncy, tight, elastic skin. And that's because we have a surplus of collagen. We have lots of collagen. And if you've been listening for a while, you know collagen is the protein in your body that makes your skin firm, bouncy, and elastic. So it makes your skin appear youthful. Over time, we are going to lose collagen. You lose collagen every single year. And unfortunately, naturally, we do not replace that collagen. So we're just on this collagen decline with time. And with that collagen loss, you are going to see changes in your skin. You're going to see skin laxity. So our skin is going to lose support. And this can be a big cause of smile lines. The next cause of smile lines that has to do with aging is the actual descension and deflation of our fat pads. So this is a funny concept in my practice. Patients are always like, oh my gosh, I don't want my face to look fat with filler. And this is so interesting because fat actually keeps our face looking young. And you can see this with celebrities like Adele prior to her weight loss and prior to getting injectables. When she lost a bunch of weight, people were like, oh my gosh, she looks older. I get so many patients in my practice that are on Ozempic and they're like, my skin looks different. I feel old. And that's because volume in our face keeps us looking young. So when we lose our deep fat, and that is the fat that supports the face. So we have deep fat pads in multiple areas. And when those fat pads start to deflate, we lose the cushion and we lose the support. So what's going to happen is our fat pads, our deep fat pads are deflating and our superficial fat pads are going to descend because there's nothing to hold them up. And superficial fat starts to fall. So that's where we start to see increased nasolabial folds, smile lines. We even start to notice some jowling because of this, because our fat pads are starting to drop downwards. The next thing that's going to happen is we're going to have changes in our bone density. So our bone starts to thin with age. And what happens is the bone in this area, the maxilla, is actually going to move backwards. So we are going to lose that structure and support around the mouth. And that is going to increase the appearance of smile lines, nasolabial folds. In addition to aging, we have genetics that are a primary factor in contributing to how severe or how deep our smile lines are. Some people genetically are just more predisposed to having deeper appearance of smile lines than others. In addition to genetics, we have to understand that another key factor that contributes to smile lines and how they look is going to be the quality of your skin. And our skin, you guys, is the largest organ in our body. We only get one skin, so it's really important that we take care of it. Over time, the quality of our skin is going to get more dry. It is also going to lose its elasticity. It's going to lose its support, like we talked about with that loss of collagen. So you may notice the quality of your skin when it appears more dry, dull, and dehydrated. It will make your smile lines more apparent. And also, in addition to that, things like UV exposure and smoking are going to be environmental factors that also increase the signs of aging in our face, especially smile lines. So I have said this before, I will say it again, do not skip your sunscreen. That is like one of the most important things. It's one of the most basic things that you can do at home. It's super cost effective and it will be hugely impactful in preventing those smile lines from getting worse with age. So this cause actually might surprise you, but another cause of smile lines is actually side sleeping. And it's because as we sleep on our sides, and you guys, I am a side sleeper. I am so guilty of it. No matter what I do, I cannot sleep on my back, with the exception of when I am super pregnant and I physically can't sleep on my side. But otherwise, I'm a side sleeper. And what happens is as we lay on our pillow, so if you imagine this like smooshing of your face, you're going to etch in those creases. We're sleeping for 6 to 8 hours a night, sometimes more. So that is 6 to 8 hours or longer of pressure of smooshing your face. And that is going to make your smile lines appear worse. Now that we've talked about the causes of smile lines, I want to get into what we can do. First, I want to talk about at-home treatments. It's super important to understand that at-home treatments are not going to improve deep or moderate to severe smile lines. So if you're looking in the mirror and you're like, whoa, my smile lines are pretty moderate to severe, at-home treatments are not going to create a big impact. At-home treatments are going to really impact the quality of our skin. And the things that I recommend doing at home are, number one, wear your SPF, which we talked about. This is so preventable, you guys. And you want to look for a sunscreen that's not mixed into your makeup, that's not mixed into your tinted moisturizer. We want sunscreen by itself. And that's because mixing sunscreen with anything else can actually change the way that the sunscreen works. So we want to make sure that the sunscreen is giving its maximum efficacy, that is working to the best of its ability. So I recommend doing your sunscreen, waiting a few minutes, and then applying your makeup on top. One of my favorite sunscreens that I absolutely love because it looks like sunscreen makeup, but it is not makeup, is Color Science. So I will link it for you guys in the show notes. Color Science is huge if you are wanting the ultimate hack to look like you have makeup on, but really it's your sunscreen. This is my number one recommendation. The next thing that I'm going to recommend at home is using a retinoid. And I think I talk about retinoids, you guys, in like almost every single episode. So if you don't understand how important it is by now, you have not been listening. Retinoids are so important because retinoids are going to increase your cell turnover. So think new, fresh baby skin. This is a huge way that we can prevent signs of aging. We can help with collagen formation. We can help with fine lines, wrinkles. So use your retinoid every single night. If you are very sensitive to retinoids or you can't use a retinoid because you're pregnant, like me, then I recommend using a pregnancy-safe retinoid alternative. It is amazing for sensitive skin. It actually works very similar to retinol, so you will get really similar results. I am obsessed with Bakuchiol serum. That is what it's called. It is called Bakuchiol, and Bakuchiol is that plant-based retinoid alternative. So those are two options for you guys, whether you are somebody that is using retinol, interested in retinol, or if you can't use a retinol, then I recommend trying at least one of these things because the more collagen that we have, the better our skin is going to look and feel. And the more collagen that we have, the less noticeable the smile lines are going to be. Another topical skincare ingredient that I love for smile lines is going to be growth factor. And growth factors are going to help stimulate collagen and tighten your skin. There are a couple growth factors on the market that I really love. TNS is my absolute favorite. It is by Skin Medica, and it has clinical data, you guys, that show that it helps with tightening your skin within 2 weeks. So you can see an improvement in fine lines and wrinkles. This is like my Botox in a bottle. It is my go-to product. It is a little bit more on on the costly side. So if you are on a budget and you want to decide, okay, where should I invest my money? I'm going to tell you to skip the growth factor and stick to the retinoid and SPF, just because those are going to be really great for smile lines, but they're going to be a little bit more cost effective. However, if you can afford it, absolutely adding a growth factor into your skincare routine is going to make a really big difference. The next thing that I love to do at home is actually face taping. And this is funny. I did an entire episode on face taping. So if you missed it, make sure you check it out. But face taping is absolutely amazing for sleep lines. And that's because it's going to hold your face in place while you sleep. So I am a huge fan of face taping. I face tape almost every single night because I'm a side sleeper. And this has been hugely impactful because it's going to prevent that smooshing of your face when you're laying on your side. So face taping is a really important thing that can help prevent smile lines. Now, it's important to understand face tape does not work like Botox. So it is not going to help prevent lines from muscle movement. So frowning, raising your brows, those lines are not going to go away with face tape. However, it really does help with sleep lines. The last in-home treatment that I really love is going to be red light therapy. And red light therapy, again, this is an adjunct treatment. So you're not going to expect to see dramatic results, but this is something that's going to really help improve the quality of your skin. I love red light therapy because what it's doing is it's actually promoting collagen synthesis. So if you want to hear more about red light, make sure you check out my episode on red light therapy. I dedicated an entire episode to my favorite LED masks, who is a candidate, and what results that you can expect. Now let's talk about in-office treatments. So we've talked about things that you can do at home. Now, what can you do in the office? And if you are having more moderate to severe smile lines, this is going to give you the most significant impact. The number one thing that we can do is add filler, and filler is a hyaluronic acid. So my biggest takeaway, you guys, is that we cannot just add filler to make your smile lines go away. Now, we can, but then you're gonna look very weird. You're gonna look like cat lady. You're gonna look very unnatural. So this is not something that I recommend. What I recommend doing with filler is treating the cause. So again, remember, what happens as we age is we lose our fat pads. So this descension of the fat pads, the dropping of them, and the deflation is what's contributing to your smile lines. Another thing that's contributing is that loss of bone. So one of my favorite areas to treat with filler is actually the piriform space. And that's a space that's right by your nose. And because of those bone changes and those fat changes, adding some dermal filler in this area can really help lift and support the smile lines. I also will treat directly in the line. Now, again, I am just so conservative. We cannot just fill the lines and think we're gonna look natural. So it's important that we frame the face with filler, meaning adding filler to those areas like the piriform space or even the mid-cheek. Sometimes adding filler to the mid-cheek can make a really big impact as well because we're lifting and supporting the area around the smile line. So this is what I like to do with filler, being very conservative and then adding a minimal amount in the actual line. I do get a very significant improvement. The next treatment that I love in office is going to be a biostimulator. And biostimulators are one of my favorite things. Biostimulators actually force your body to produce their own collagen. So it is a way to produce collagen in your body. So think firm skin, bouncy skin, tight skin. These are not going to make your smile lines go away, but they will improve your smile lines. And it's actually one of my favorite ways to do it because it looks very natural. Now, if you want to learn more about biostimulators, I also did an episode specifically about biostimulators versus filler, so make sure to check that out. But for the most part, they are just going to stimulate collagen, make your skin look better, improve that quality of your skin. Plus side is you will always look natural. Now, the downside of them is it takes multiple treatments to achieve the desired results. So it's more of that slow and steady wins the race. Biostimulators that I love are going to be Sculptra and Hyperdilute Radius. Sculptra is a PLLA, polyl lactic acid biostimulator. So what that means is we are actually putting PLLA in your body, and that is going to act like a fertilizer to stimulate your own collagen. And then there's another product called Hyperdilute Radius, and this is a calcium hydroxyphate product. And so it is going to stimulate collagen similar to Sculptra. But what I really like about Hyperdilute Radius is that it is going to give you a little bit of that instant volume. So pending the significance of your volume loss, we may do a combination of both, or we may choose one versus the other. Another in-office treatment that I love for smile lines is going to be PDO Threads. PDO Threads are freaking amazing. There are two types. There are some called mono threads, and those are little smooth threads. So think of those as Spanx for your face. They are going to stimulate your body's own natural collagen by creating like a scaffold. So I love to layer PDO threads, particularly smooth threads, all over the smile lines to help stimulate collagen. This is one of my go-to moves in the practice. Think of these as the Spanx for your face. Now, the other type of PDO thread that I really love is going to be a barbed thread. So these are going to lift the tissue. So I love using PDO threads for smile line treatment, and that's because I can actually insert the barbed thread and I can create a vector. So think about this line of where I want to lift, and those are going to actually lift. So adding in PDO threads, barbed and smooth, in addition to biostimulators, I have gotten amazing results. I even use PDO threads with fillers. They are one of my go-to treatments. Now, a lot of people listening might be like, oh my gosh, PDO threads sound crazy. I've heard so many things that you can't get a facelift, blah, blah, blah. And I'm telling you, there is always going to be a lot of misconceptions on the market about PDO threads, about biostimulators and getting a facelift. But I can tell you guys from expert opinions from plastic surgeons that I've worked with firsthand that as long as you take a break, meaning you need to make sure you're doing no biostimulators for a year before a facelift, you will be totally fine. I've had 3 PDO thread lifts and I definitely plan on getting a facelift one day. I do Sculptra Hybrid Radius on myself every single year. I don't inject myself. My team does it for me. I want to point that out. But I do get these treatments and I will get a facelift. And I have patients that have gotten facelifts that I've treated with biostimulators and threads, and we've just put them on a plan to take a break prior to getting those procedures done. Another key thing to keep in mind is we need to understand that going to a provider that knows their depths and their layers is very important, because if you are over injected or you are injected in the wrong depth, the wrong plane, if you have threads inserted improperly, then yes, these can cause big complications and they can prevent a facelift because they are being misinjected or misplaced. So make sure that you guys look for an expert injector that has a consultation with you. Make sure you're asking for before and afters. Make sure that you are reading their reviews. Ask them what continuing education they're doing. What is their education? What do they do every year to keep their skills up? These are very important things. And I think one of the most important, you guys, is to build a connection with your provider. It's all about building relationships. Finding the right provider is like dating. You're going on a date, you're seeing what that person is about, you're making sure that they check all of your boxes and that you guys can make an aesthetic plan, because this is a journey. It is not something that is done overnight. It's not a one-size-fits-all approach. So it's very important that you trust your provider and that you have the right person to treat you along your aesthetic journey. The next office treatment that I love for smile lines is going to be skin tightening. Remember, I said as we age, our skin is going to become more lax, so it's important that we tighten the skin. In my office, I am all about natural. I want to do as much as I can to actually make you young. Not just make you look young, but make you young. And what I mean by that is I utilize skin tightening procedures on a regular basis. I utilize biostimulators, PDO threads, and then I just use filler to enhance, because filler needs to be done appropriately and strategically so that you don't look overdone. I love filler. I use it all of the time, but I use it in combination with these other treatments to make sure that we maintain a natural result and you never look like a pillow face. So what skin tightening procedures do I love? Number 1 is Morpheus. Morpheus is my go-to. Morpheus is radio frequency microneedling. So radio frequency is delivering heat deep into the tissue, and those needles are going to work as the delivery device. So the needles are literally driving that energy deep into the skin. That is going to stimulate collagen and cause a tissue contraction. So you're going to be getting a tightening effect. Now, Morpheus is absolutely amazing. It's my go-to. Something that you can do a step above Morpheus, and this has to be done by a nurse practitioner, by an MD, somebody highly trained, is actually called FaceTite. And it's by the same company as Morpheus, which is InMode, but this procedure is a little bit more invasive. What we do is we make teeny little incisions and we insert a probe and actually heat up fat and tighten skin from within. It is non-surgical, it's minimally invasive and super safe when performed by the right person, I get amazing results from this in my practice, you guys. So pending how significant your volume loss is and what areas you want to treat, we may do something like FaceTite in addition to Morpheus to help with the lower face. We're not going to use FaceTite directly in the smile lines. We're going to treat that with Morpheus. But again, it's all about areas around the smile lines, building that support. So taking off some of that weight in the lower face, doing a little bit more of an invasive procedure like FaceTite can be hugely impactful if you are a candidate. Now, Morpheus is just my go-to. There are other skin tightening devices on the market like Softwave, there's Vivace, I'm sure there's many more that I'm not naming right now. Morpheus is just the one that I utilize in my practice the most, and I can say I get the absolute best results with. Now, a lot of people listening right now might be like, well, I'm scared of Morpheus, will it melt my fat? And the answer is only when intended. So Morpheus is not going to melt your fat if not intended. And what I mean by that is you need to go to a trained provider that understands the layers of your skin. We should not be melting fat by your smile lines. This is fat we want. So we should be going at very superficial depths here in order to tighten the skin. We do not want to melt fat in that area. Areas that we do want to melt fat would be like the jowls and submental areas. So going to a trained provider is very important when getting a Morpheus treatment. The other thing that's important is making sure that they offer adequate pain control. In my opinion, Morpheus is very painful. However, in my practice, I do what's called double numbing. So not only do we topical numb you, but we will actually inject you with lidocaine like a nerve block so you get the least amount of pain possible during your treatment. And to top it off, we use a little bit of laughing gas called Pronox so you can literally live your best life. Thank you guys for tuning into today's episode. I hope after this you understand what causes smile lines, how to treat them, and things you can do in office and at home. I will see you guys next week.